COVID-19 is transmitted through the air.
Okay, so that's been hotly debated for a while between specialists and throughout the media. So it's good to have a definitive answer on that one. Another one that's a big myth is if it can be transmitted by a person who has no symptoms. So there's many of us that are healthy at home, and we're self-isolating even though we feel completely normal. Is there a benefit to this as well?
Yes, even if you are feeling great and you're at home, you can still transmit COVID-19 if you have the infection. And one of the unusual aspects of this viral disease is that a person who feels well and is completely asymptomatic can actually be highly infectious for a period of days before their symptoms erupt or become clear. So yes, you can feel great and you should still stay at home and watch Netflix or do your work.
Okay, so we're still doing a big part by all staying home then.
Yes.
So a selfish one here is, are the younger population susceptible to the virus? We've heard there's the older generations are much more susceptible, but are younger generations also susceptible to this virus?
So yes, the statistics are showing that those of us who are over age 60 or 65 are more susceptible to getting serious COVID-19 disease. Part of that picture has to do with people who have other underlying respiratory issues. So if you're over 60, 65, and you have what's called a comorbidity, such as asthma, COPD, or any other sort of lung disorder, you're at increased risk of serious disease. But having said that, Graham, all of you youthful people feeling great, you still need to be careful because serious illness and deaths have occurred in all age groups. So none of us can take this lightly.
All right, so I guess I'll be canceling my vacations then. One thing we see a lot of people do when walking around outside, taking our daily walks or going to grocery stores is wearing surgical masks. Do these surgical masks provide protection for the wearer?
So the masks that you see out in public are the surgical masks, and they are not particularly protective for the person wearing the masks because small particles can still enter through the sides and into your airways. However, it is known that those masks are helpful in that they protect somebody who's already sick from sending their infectious droplets out into the house or into the environment. If people need a higher level of protection, say healthcare workers, they wear what's called an N95 mask, and the N95 masks are designed to filter out 95% of very small particles. Okay. But the general public is not wearing N95 masks, nor should they.
Right. I mean, they seem to be absolutely essential for our healthcare workers and in great demand right now. So
yes.
All right, and the final question here is, we've heard a lot about cold weather versus hot weather, humid climate, dry climate, where we are globally between each spot. How does this affect the spread of this virus?
Another great question, and one that we're watching carefully as we move into the spring season. So COVID-19 virus is affected by moisture levels. When it's cold outside, we bring that air into our buildings and warm it up. That consequently drives the humidity way down. And it's the low humidity that is associated with increased transmission and illness. So as the weather warms up, we'll bring in outdoor air into our homes and buildings. We don't heat it up as much. So that means that we don't drive the moisture level down, which is better. That's why it's really important when it is cold out to use extra humidification indoors to reach a safe range of 40 to 60% relative humidity.
Right, and we've been talking about that 40 to 60% relative humidity for a while, and it is definitely essential for these spreads and reducing them.
Yes.
I'd like to thank everyone for joining us today. Like I said, we'll be switching to a Monday, Wednesday, Friday format. Please follow Stephanie on LinkedIn. She's posting plenty of great articles with data available there. Stephanie has also been appointed to the new ASHRAE Epidemic Task Force as a voting member, and she'll be working hard with them to pass out new recommendations for our building environment. On Friday's episode, we'll be going through current recommendations from governing bodies for HVAC, both North American and European as well, and talking about how just the plan in there and seeing how that develops. Thanks,
Great.
everyone.
Thank you, Graham. Thanks, everyone. See you Friday.